Joining us now to explain how this is all going to work is Michael Maudlin. You're new to Sweetser.
I am.
Been in law enforcement for quite some time at this point. And I think there's really an increased focus we were talking about, especially in the past few weeks, this intersection between mental health and law enforcement. What will your role be with Sweetser?
The role I'm functioning in is to be a resource and to provide de-escalation services, resource management, and to free up law enforcement officers to do things that they're more needed for on an emergency basis, and also to get help to people in a timely manner.
And so why is it so important to have that partnership, to have mental health services and to have that kind of support with law enforcement, kind of teaming up together to go tackle some of these challenges?
When someone's in a mental health crisis, it can sometimes look different to the outside world. It may look like a crime or a disturbance, when in fact that's not the kind of service they need. And law enforcement does not want to incarcerate people who don't need to be incarcerated. So the law enforcement community is really focused on trying to de-escalate this. As a Sweetser, I think the role is to try to reduce the amount of time those folks are not getting services they need.
And so what do you anticipate the impact to be? Do you anticipate a more positive outcome when you go out on one of these calls? Or are you going out with police? And how does that kind of intersection work?
A good question. It's a combination. Sometimes it's co-responding with an officer or a deputy. Sometimes I'm just sent and follow up. It depends on the situation. I've been out a great deal in the last 6 weeks. And so we've had pretty positive impact. And we've had reduced calls for service with some of those individuals because they've gotten the help they needed.
So what is your approach when you go out on one of those calls?
First of all, to listen. And that's an important piece. It's find out where they're at and what they think they need, and then try to redirect them, try to get them the right resources. Whether it be mental health resources, whether it be homelessness issues, food issues, we can direct them the right, we have the resources available.
Do you see this as a growing model in Maine, across the country, of pairing law enforcement essentially with these mental health professionals?
Absolutely. I think there's a desperate need to increase it. You could use more than one of me where I'm at right now. And so I think as the program grows, I think police chiefs, police officers, sheriffs, deputies, and the community are going to be pleased with the results. I think we're going to reduce the amount of time that these folks are having to face crisis.
Such an important topic, and you have a very unique background, having law enforcement and as well as other expertise as well. What kind of person does it take to be able to be in the position that you're in?
Well, again, I was a social worker before I was a police officer. I think you've got to be open-minded. Corny expression, but it's real. You want to make a difference. And the ability to listen, both to law enforcement and mental health resources and the individual we're trying to assist, or the family. Sometimes it's an entire family I'm working with.
And as far as the access, is this something that happens by default when police get a call, or people who feel like they may need that kind of support, how do they get it?
There is a main crisis line that's still available. So routinely I am involved when dispatch or a deputy or a police officer is in a situation where they think I could be of help. Someone they've known for some time, had previous contacts with, or a new situation that needs de-escalating. I can come help.
Okay. Our thanks to you and Sweetser for this important work in the conversation we had today. Thanks for coming in.
Thank you for the time.